Good afternoon. I'm Kai-Yi Lee, Professor of Chemistry and Provost of the University of Chicago. I'm glad to be able to gather in this virtual format with all of you today as we embark on the winter quarter. I would like to start by acknowledging the tragic loss of Iran Fan, a PhD student in a joint program of the Booth School of Business and the Kenneth C. Griffin Department of Economics. I know that this is weighing heavily on our entire community, and we send our condolences to Iran's family and friends. We will be holding a candlelight remembrance vigil for him this afternoon at 4 p.m. on the main quad, and all members of our community are invited to attend in person or remotely. This past year has been a year like no other. A worldwide pandemic has caused us to re-examine and reconfigure how we live. Losses from COVID-19, not only in deaths, but in missed social and physical interaction, have touched us all. Many of us have also been deeply affected by the recent violence in our capital and the ongoing political and social unrest. I'm grateful to you for your extraordinary efforts under such challenging circumstances. As faculty, other academic appointees, postdoctoral researchers, and staff, you play a critical role in fulfilling the university's mission of academic and research excellence. Thank you for supporting our students through this unprecedented time while continuing to prioritize the health, safety, and well-being of each other and the surrounding community. I have been impressed and inspired by how you continue to come up with new and effective ways to share knowledge, conduct research, and create community across distance. Looking forward to the quarter ahead, we are at a different point as a city and a university than we were back in the fall. We are optimistic about the vaccine, which you will hear more about next. We also have months of experience, lessons learned, and best practices from peer institutions that would help us go forward while we adjust to the rapidly changing landscape. While scientific advances give us reason to be hopeful for a healthier future, it is important that we remain vigilant and follow the health pact. If you are on campus, please wear a face mask. Maintain social distance and avoid large gatherings. Self-monitor for symptoms of COVID-19 and collaborate with contact tracers should they reach out to you. These proven methods will help us continue to reduce risk and address the health and safety of our surrounding community. For more on this subject, we are fortunate to have the expert guidance of University of Chicago Medicine. Dr. Stephen Weber will now share information about the status of COVID-19 and vaccination efforts.
Thank you very much, Provost Lee, and thank you all for joining the session today. I just want to also add my gratitude to all of you for the manner in which we've come together as a community over the last months in order to confront the pandemic, both in terms of some of the things that I'll talk about and then all the things that Provost Lee mentioned. So I have deep appreciation and admiration for the work that this group has undertaken. As we prepare to begin the winter quarter, we look to the current situation across the region, across our city. Each day, the state is reporting somewhere between 5,000 to 6,000 cases, new cases of COVID. That's actually a little bit down from where we ended the last quarter, but still obviously a substantial number of patients. Upwards of 1,000 to 1,200 of those patients are in our city here in Chicago. And I can tell you that at the health system, where I serve as chief medical officer and I'm a professor of infectious disease and a practicing physician in that space, we're still seeing patients coming in from our community. While the number of patients in the hospital is down by almost 2/3 from our peak earlier last year, we're still monitoring very, very closely and still facing a burden of complex and serious disease. As we go forward, we look to some of the concerns that were raised around the holidays, beginning with Thanksgiving and now through the end of the year holidays, and concerns about surges of pandemic. And certainly while here in Chicago, we haven't been as affected as we've seen in other parts of the country, folks in Southern California come to mind particularly, we stand ready and anticipate a continued increase in cases as we go forward. At best, we might hope for things to remain as they do for the foreseeable future, but as Provost Lee mentioned, I'll come to in a moment, work around the vaccine, we hope is going to really have an impact on that. As we look to this quarter and to the spring in general, we want to revisit what brought us such success and achievement in the fall. And it really came down to the work that all of you did and all the passion and intensity with which you abided by some of the expectations that were set out for our community. We really were successful. And I've been grateful for the opportunity, like my colleague, Dr. Landon, to have outreach from other urban campuses and universities asking how we were able to do what we did. And while we can certainly reference all the planning that happened, always featured prominently is the engagement of all of you to make this happen for the benefits of our teams, our students, and certainly the community. One piece that I'm asked about frequently right now is around the so-called new variants of COVID or coronavirus. These go by different names. Scientifically, we think of them as the B117 strains, a set of viruses that appear to have mutated and evolved from what we were dealing with originally. And as you've seen in the general media, a lot of concerns about these strains being more contagious and perhaps in some cases even more aggressive and causing serious illness. We're still understanding a lot about these new strains, but there's one piece that we already feel comfortable with, which is that the measures that we've undertaken to date, social distancing, masks, hand hygiene, contact tracing around folks who've been ill, really still stand true and seem effective even with these new variants. So while we don't yet know the extent to which these particular strains have penetrated the Chicago or Illinois area, we feel like we're already equipped with some of the tools to help address them and to meet them. Dr. Land, in her previous remarks, talks about how combating the pandemic involves layers of protection, some of the things I mentioned, and vaccine is now the latest layer that we have. And again, we'll say more in detail about some of the planning around that. But what we hope to see is that by doubling down, even in the face of a highly transmissible virus, that we can continue to sustain the achievements that we've had and continue to serve, again, our students, each other, and the community the way we have is really what's most important at this point. So what of the vaccine? And that's obviously the very hot topic, not just in Chicago on campus, but around the globe right now. As we talk about our vaccine planning, I want people to keep in mind that everything we do around vaccines is determined and predicated by departments of public health. For us in Chicago, that is the Chicago Department of Public Health. For the rest of the state, it's obviously the Illinois Department of Public Health, but there is variation from jurisdiction to jurisdiction. So you might see different approaches in different states and even different cities that might not reconcile exactly with what we're being asked to follow in terms of the Chicago Department of Public Health. The city began vaccinating healthcare workers about a month ago, and the University of Chicago Health System joined in that. The focus was initially on those who were most immediately in contact with patients, but also embraced the notion of all those individuals who support the healthcare mission. All those plans are vetted by the city and reviewed and consistent with what's happening at other organizations, but still a very highly focused approach. With that in mind, we adopted a number of frameworks for how we think about our vaccine plans on the medical campus, and we expect that'll carry through as we start serving other communities. And that's the idea that whatever we're doing with vaccine, we're certainly going to abide by what CDPH is asking of us. Second, that we want to be very transparent about what our intention is, that our plans need to be simple, because when you add complexity, you slow down vaccination. And as an infectious disease doctor, I don't want to see that happen. And lastly, but maybe most importantly, is the idea of equity. We know that this pandemic has not only exposed, but aggravated inequalities in healthcare and care delivery around the city, the state, and around the world. And to that end, we want to make sure the vaccine offers an inflection point where we can do better. On the medical campus, we vaccinated about 10,000 of our employees, and we've also become a major vaccine source for healthcare workers around the South Side. The aim being to outreach, whether those folks have an affiliation with our health system or not, to recognize that the current resources from the city and others may not be enough to reach every doctor's office or oral health clinic or physical therapy location across the South Side. And to that end, we've engaged and vaccinated over 1,500 of those individuals as well. To date, the health system has delivered almost 20% of the total vaccines that have been delivered across the city of Chicago. That isn't something we compete on, but a recognition that we're all in this together across the city in our efforts to offer protection. I have to acknowledge I don't just promote and speak for the vaccine. I'm also a satisfied customer because I see patients. I've received my first dose of vaccine. I'll get my second dose later today. So I say that for two reasons. One is an acknowledgement that there are elements of our community of all backgrounds, but particularly for communities that have been underserved in the past or disenfranchised from care, and often among people of color, about mistrust about the vaccine. And all I can offer today in this brief time to say is, I want to be safe myself, and I accepted this vaccine because I know the alternative around COVID is so severe and potentially so deadly. There'll be a lot more conversations we go forward, but I keep encouraging folks at every town hall, when your time comes to receive the vaccine, I hope you'll seize the opportunity. What we're seeing about the vaccine is people tolerating it well. That second dose can be associated with people feeling unwell for a day or so. So I may not be as chipper later today, but at the same time, that's a small price to pay for the benefit that we see. Based on the CDC's most recent recommendations and very recent feedback from the city and state, what we're seeing is that university employees will have access to the vaccine as part of what they call phase 1C. 1A was the healthcare workers and long-term care facilities, nursing homes. 1B includes patients and community members at very high risk by certain age and medical thresholds. Also includes a set of essential frontline workers. And the clarification we've had in the last few days is that while K through 12 educators are included in that group, the state and city and the Illinois Board of Higher Education has asked higher education institutions like us to move to at least wave 1C. And we expect we'll get more word about that, but we're going to continue to advocate for all of our community, including obviously the university. Folks often have questions in conjunction with that, but what about our students, one of the key populations that we serve? And right now, we're still looking for an understanding about that. Students are not called out in any of the existing waves right now. And so unless new instructions would actually come with the larger general population. But again, this is changing each and every day. And I'll tell you, we were really gratified in the last 24 hours, the city actually signaled us to begin vaccinating patients in our community. So we're very excited to move forward in the next week, start reaching out to folks of higher risk because of age or medical condition, and particularly drawing from our immediate health services area, some of the most underserved neighborhoods in the city, to reach out and start vaccinating that critical population. There'll be a lot more about this in the time ahead, but that is an important step forward, both for the city and for the well-being of our community. So with that, Provost Lee, I'll come to a close, and I hope this is useful and gives a little context of where we stand right now. Again, you all have my appreciation and admiration for what you've been doing, and I look forward to successful next quarter. And with that, I'll turn it back to you, Provost Lee.
Thank you, Dr. Weber. Build on what was said, I just want to reiterate the university's commitment to do everything we can to make sure that our faculty, students, staff, and members of our broader community have access to the vaccine as soon as possible. We will be working in close consultation with the medical center and promise to communicate with you along the way. We ask for your continued patience and understanding as this rapidly evolving rollout proceeds. Now, I would like to welcome Vice Provost Jason Merchant to share an update on instructional plans and UChicago grad resources.
Thank you, Provost Lee. I want to talk a little bit about what's happening this winter quarter, and looking back to the fall, mention a little bit of the results of the survey that we took in the fall. So right now, we've just, of course, started the winter quarter under much more difficult circumstances than we had hoped for. The quarter is on a slightly different calendar than we have had in the past. This is the result of an early implementation of the Roth report on the calendar, which was completed 2 years ago. Last year, we announced that we'd be implementing it next year, but because of COVID, we decided to implement it early. This means we have a 10-week quarter with 9 weeks of instruction, a week of finals starting this week, as you all already know. This means that we've gone from a total number of instructional days from 46 to 44 this quarter, and from 47 to 45 next quarter. The other changes that we have is that spring break will remain, but finals week is slightly compressed. It's only 4 days this quarter. Spring break, as you know, many of our peers have already announced that they are eliminating spring break, not all, but most of the semester schools are getting rid of spring break. We decided not to do that. We'll continue to have the regular 1 week of spring break, but we are encouraging students who are on campus to remain on campus. We'd like to minimize travel, and we're going to be working with CSL to provide things to do for the spring stay, as we're going to be calling it. So the winter courses we're offering right now 2,620 to be precise. 10% of those have an in-person component, and the remainder are remote only. So this is coming out of our experiences in the fall. Students did appreciate the in-person classes, and of course, you know, we worked very hard to be able to create spaces on campus for those classes. But most of our courses needed to be delivered remotely, and I have to say, I'm very, I want to say thanks to all the faculty who did such a great job in delivering remote instruction. I know living on Zoom and preparing these sort of materials in classes has not been easy, and I'm very happy to say that it's been very effective. In fact, the student survey that we put out in the fall, a majority of students gave a positive rating for effectiveness in teaching. One thing we did find out in the fall, so as you know, all of you were invited to participate in the fall. We sent a survey to all students at the university and all academic appointees, faculty, lecturers, and others in consultation with the committee of the council of the faculty and with the help of student government. That went to everyone, 17,000 students, and about 3,000 faculty and other academic appointees were invited to participate. The response rates for academic appointees, we had over 1,000 responses, 38%. With students, we had about 16% response rate, which is not great, but it's also not unusual for surveys of this kind. So I'm going to say just a tiny bit about what we found in that survey, but you'll remember that right before, at the end of the quarter, Provost Lee sent out an email to everyone that you should have gotten with a link to the full report. We've summarized some of it in a short report, but then we've included appendices that have all the full data, all of the results that we got, all the numerical results. So obviously there were lots of challenges in the fall, but we were very happy to see that students and faculty were largely positive about their experiences, both remote and in person in the classroom. The things that were not so positive were the ability of students to interact with faculty and with each other outside of class. So some of the things, and to study. So we had very limited study spaces on campus in the fall. And so what we did is we decided to try to find ways to build out study spaces on campus. So the library, working with the library, we've opened up study spaces in the library that will include the ability for students to be able to do Zoom classes in the library. This will be a reservation system just like it is already, but it'll be zoned for not so quiet. In other words, students will have to bring their own laptops and headphones, but they'll be able to do remote classes in the library. And so I wanted to say thanks to the library for helping with that, and to CSL. There'll be spaces in Crerar and in Logan and elsewhere on campus as well for the winter. If you're teaching this quarter, you should have received an email from me and Kevin Boyd, head of ITS, before break, and again recently with information about Zoom security. We have not had major incidents, and we would like to keep it that way, but we also realize that a lot of people are teaching for the first time, including graduate students who are teaching, and so we want to make sure that they get that information about how to manage Zoom participation. There's a whole series of workshops being offered this quarter as we did in the fall. The Chicago Center of Teaching for Teaching the Library and IT Services is continuing to offer those, and those are open to everyone, not just faculty and academic appointees, but also to grad students who are in instructional roles. So instructors also should have received an email from me and the University Registrar, Scott Campbell, reminding you about the new shopping period policies and encouraging you to put your syllabus under the syllabus section on Canvas. That's very important for this week and next, when students are still able to register for classes and during the add drop period. Since most of it is remotely, if you put your syllabus under the syllabus link in Canvas, that means that they'll be able to access that without actually being registered in the class. UChicago Grad has been serving the needs of grad students remotely ever since the spring. So we've shifted entirely to doing all of our internship, fellowship, and other workshops online. We've had more than 1,400 grad students coming through our advising and events there. Compared to last autumn, our event attendance and advising are up quite a bit, including especially around the challenging job market. We have about 25% more attendees at GraduCon than we did the previous year. That was all virtual, and I think that probably is one of the main reasons that people were able to do that. Finally, we've tried to create a virtual grad student lounge, because one of the things that we noticed in the survey that was reported is that students are finding it very difficult to connect in the sort of interstitial spaces that are normal to university life before and after class and before and after workshops. So we're trying to make spaces both for studying per se, also for writing. Our writing groups are continuing, and also sort of a virtual lounge. These are, we hope, help to ameliorate, although we understand that they are no replacement for the actual lounges that we're used to and that contribute to the social and intellectual environment that we're used to. So with that, I will turn this over to Casey Cook, the Associate Vice President for Human Resources, who can tell us a little bit more about remote work. Thank you.
Great. Thanks, Jason. Sure appreciate it. Good afternoon, colleagues. It's really good to be with you today. I did also want to take a moment to recognize the many talented individuals across campus who've both contributed in substantial ways and also persevered through this time. So thank you very much. I wanted to begin today by speaking about remote work for our campus, and we'll also share a few additional updates with the community today. So first, the university's current work from home approach is expected to stay in place at least through winter quarter. Most offices should anticipate continuing to work from home through that period. In-person work should be limited to tasks that can only be completed on campus, such as education, research, student and support services, and other critical campus services. With classes resuming this week and more students and faculty present on campus, there will also be an increased presence of staff in some areas to support those functions. I would like to share that reasons of individual convenience or efficiency are generally not sufficient to justify work on campus during this period. We're really working to keep safe density on campus throughout the quarter as we move through the first few months of the year. I also wanted to recognize and acknowledge that there have been requests to perform remote work for those who are performing remote work temporarily outside of the Chicago Metroland area during the winter quarter. Please be advised that requests from both staff and faculty should be directed to your respective dean, officer, or their delegate. Evaluation of length of time one plans to work outside of the Chicagoland area, location, and current role and responsibilities will all be evaluated with each request. I wanted to shift to a couple of things that we can look forward to later on in the calendar year. As you recall, in response to the financial impacts of COVID-19, the university made the very difficult decision to suspend retirement contributions during FY21. And you'll also recall an email from the president and provost in November that the university plans to reinstitute full university contributions to the 403B defined contribution retirement plans. That includes ARIP and CRP, and that will commence at the start of the next fiscal year on July 1st of 2021. Additionally, and while the details of this year's merit compensation process are still being developed, more information about the process will be released as we get closer to the end of the fiscal year. And with that brief update, please join me in welcoming Melina Hale, Professor and Vice Provost, who will share information regarding the Workplace Working Group, updates on travel, and additional important information. Melina?
Great. Thank you, Casey, and hi, everyone. So Casey and I have been co-leading the Workplace Planning Group, which focuses on supporting staff and offices. So I'll start with a short update there and then turn to a few other announcements. First, our community and leaders guides to resumption of in-person work continue to be updated regularly. They can be found on the goforward.uchicago site and downloaded from there. In addition, we work in lockstep with the folks managing that site to make sure that the information is consistent with what's on GoForward. So you can also find the same information on those web pages. The Workplace Group continues to support administrative offices as they develop and adapt in-person work plans. For those of you in those efforts, please feel free to reach out to us with any questions. Part of the support we're providing is to have regular virtual meetings with our COVID unit leads who have been terrific at overseeing the COVID response in their units. At those meetings, we review updates to the information in the guides and then go forward. We also have had peer sharing experiences, so that you can learn from each other, and have had breakout rooms to allow for just open conversation among COVID unit leads. If you'd like more information about that opportunity, you can reach out to covidstaffup@uchicago.edu, or you can just email me too. So other announcements. First, travel. We wanted to remind you that the university continues to suspend university-sponsored travel. And that'll be going on for the time being. There is a travel exception process, but exceptions are rare and they need to be pre-approved by unit leaders, so deans or officers. You can find information on the travel policy in the guides or on the Go Forward website. And you can also reach out to Kenyatta Futterman. Her email for this type of question is risk@uchicago.edu. Now, although travel is suspended, we do know that some additional people will be coming back to campus. And so we have a few announcements about new opportunities there. First, we're pleased to share that faculty, including emeriti and staff, now have access to the Ratner Athletic Center for winter quarter. So this is expanded from the student-only access from fall quarter. Of course, things look different. In accordance with guidance from the Chicago Department of Public Health and UChicago Medicine, building capacity has been reduced, and other operational changes and safety protocols are in place. Membership is complimentary in January, which is great, and will be $20 per month starting in February. Membership registration is required even in January. You must also book your visits in advance through Ratner's online reservation system. So more information both about the membership application and also how to reserve spots in the gym are available at the Department of Athletics and Recreation website. Also open on campus are a range of dining options. So many campus dining locations will be open this quarter, and there are great options for picking up food on campus. The dining staff are so nice and so eager to feed us, and they're also very mindful of safety. The cafe and market schedules may be different from your past experience. Of course, they've been adjusted with the decreased population on campus. Days and hours of operation, as well as, of course, the locations that are open, are posted at dining.uchicago.edu. And I encourage you to check that out as well. So that's the end of my updates. So please welcome next Dr. Meeta Kumar to share mental health and well-being resources for you and for students. Meeta?
Yeah, thank you, Melina. Good to be with all of you today. I'm the Director of Student Counseling at UChicago Student Wellness. So I'm going to talk briefly about the kinds of challenges students have been experiencing in the past many months, inform you about the resources available to them as UChicago students, and ways you can support them. As has already been mentioned, this has been such an incredibly difficult time all around and a particularly hard start to the winter quarter. In the past many months, we have heard from students about the array of challenges they have experienced: isolation, daily life disruptions in eating, sleeping, fatigue, sustaining motivation, worry about loved ones, and managing tremendous uncertainty in all spheres of life. The winter quarter brings additional challenges in coping with the tragic loss in our community, national crises, navigating weather, and ongoing pandemic-related restrictions, among others. We have been reminded during the course of the pandemic how essential our wellness is, not just physical, but mental and emotional. And it requires us to be very intentional and take charge of our overall wellness. So through UChicago Student Wellness, we are offering a comprehensive suite of virtual services. There are several evidence-based tools and interventions available to us today, and we now have many months of experience offering services and programs virtually. These are very accessible and effective. For mental and emotional wellness, whether students are just looking for support or struggling with more serious concerns, please know there are a range of options available to them. A trained mental health clinician is available 24 hours a day, 7 days a week by phone. Our counseling staff is also available for scheduled therapy and psychiatry appointments by phone or Zoom. In addition, there are several programs this winter quarter also available to them, like informal, anonymous drop-in consultations with a therapist, virtual workshops on topics like managing procrastination and building academic success toolkits. There are ongoing virtual support spaces for international students, LGBTQ+, and students of color communities. There's also virtual mindfulness, meditation, wellness coaching, and a 4-week positive psychology-based program called Life, Living Intentionally to Flourish Every Day, specifically for graduate and professional students. For physical health needs, there are routine and acute care options available for a wide range of concerns. For any medical issues or questions related to COVID, students can call to schedule an appointment with a student health provider. There's also a nurse advice line available to answer health-related questions and explain care options. We have a large, multidisciplinary, diverse staff and are committed to providing inclusive and culturally competent care. More information on all of our services and programs is available on our website, wellness.uchicago.edu. As faculty, instructors, and staff, you are very influential in reminding students about the importance of wellness, and please encourage them to take advantage of resources that are available to them. Their health and wellness is critical to their academic success. If you are worried about a student or unsure of how best to help them, please reach out to us. You can call or email us with your questions and concerns, and we can personally consult with you and provide guidance for next steps. You can also take a mental health first aid training course offered by wellness staff to support skill development in this area. I want you to know that we are your partners and here to assist you in supporting our students and their wellness. I wish you the best of health and safety in the coming weeks and months, and would now like to welcome back Provost Lee for closing remarks. Thank you.
Thank you very much. That brings us to the end of today's session, and thank you for taking the time to join us today. As circumstances evolve, we may have to adjust our plans, and I thank you in advance for your flexibility and understanding. We will continue sharing updates on a regular basis. I wish you all a safe and productive quarter. Thank you.